But let me welcome each and every one in reduction of NCDs, the Dean of the College of Medicine.
That Fiji and the Pacific are in the grip of a non-communicable disease crisis. I'm going to talk a little bit about that this morning. I'm not going to talk for half an hour, as the programme suggests. In fact, I noticed I get half an hour and Jackie gets quarter an hour, so maybe we'll swap that around. Because what she's got to say is far more important than what I've got to say, I assure you. I also bring apologies from the Minister, Honourable Rosie Akbar. As you may have gathered, she actually has a cabinet meeting this morning. And when you're a cabinet minister, there are some things which are fairly non-negotiable in your diary, so she does send her apologies. But I'm delighted to be able to be here. As I said, I'm here because we are facing a crisis. There are early signs, in fact, that life expectancies of the next generation may, for the first time probably in recorded history, be lower than life expectancy of our current generation. And that may be as a direct result of NCDs in some countries in our region, including our own country of Fiji. The reasons for the epidemic of NCDs, and again I'm sure I don't need to tell this audience, the reasons for the epidemic of NCDs are complex, but poor diet is certainly prominent amongst those causative factors. We see the effects of poor diets, not just in the growing problem of NCDs, but also high rates of anemia and rising obesity in our children. And one important part or contributor to an unhealthy diet is excessive consumption of salt. We know that eating too much salt is linked with high blood pressure, particularly, and in turn that can lead to two of the major causes of early death, being heart attack and stroke. And I'm pleased that Fiji, along with our neighbour Samoa, was involved or has been involved in this innovative salt reduction research project, which has just come to an end after 4 years. And the project, as you will have gathered from the diversity of people here today, was a collaborative effort between the Ministry of Health and Medical Services, the College of Medicine, Nursing and Health Sciences at FNU, the George Institute and Deakin University. The research project included a baseline assessment of salt intake and knowledge about the hazards of over-consuming salt. The project included interventions and then some follow-up measures. I've had the opportunity to look at some of the, very superficially, at some of the results. We'll hear a lot more about that during the course of the morning, but I was struck by the fact that one of the findings at the start of the survey, amongst the population surveyed, was that on average people were consuming 11.7 grams of salt per day, which is more than double the WHO recommended level of intake. The intervention stage of the study was linked with the Ministry's salt, sugar and fat reduction strategy, and it included an extensive education programme for health workers using mass media, targeting the community and community level awareness raising. There were also efforts to work with caterers, with stores and manufacturers to increase the availability of healthier, lower salt choices. I understand from the survey, and again we'll hear more about this I'm sure, I understand that participants' knowledge about salt increased significantly between the baseline and the follow-up stages. More people were able correctly to identify the recommended salt intake, less than 5 grams, and participants' behaviour towards the use of salt was also found to have changed, with more people reporting that they were choosing to use spices other than salt in their cooking. Those results are certainly encouraging, but again, my interpretation of the summary I've seen suggests that the lack of consistent labelling on foods, or perhaps labelling that is sometimes inaccurate, is still making it hard for people to make those healthy choices. Those of us working in the ministry are certainly committed to continuing efforts to improve diets in Fiji, including reducing salt intake, but also looking at other aspects of improved diet and nutrition as a contributor, as a remedy for the growth of NCDs. The National Food and Nutrition Centre is currently finalising its Food and Nutrition Action Plan, which includes certain strategies to target salt intake, continuing the good work that's already undertaken and started. And the information and data that we get from this salt research project will be invaluable in moving forward on those efforts by the National Food and Nutrition Centre. I think more generally, since we have a lot of people here from the research community, I would encourage you to maintain your efforts to work constructively with those of us operating in the policy environment to develop policies, strategies and approaches that are both economically and politically realistic to address the challenges of NCDs in general and salt intake in particular. I was reflecting last night, I once worked with a minister in another government in another country who grumbled sometimes that the academic community, the research community, was very good at telling him what was wrong and really good at quantifying how wrong things were and making him feel bad. But often the research community, he felt, was missing in action when it came to providing robust, evidence-informed, practical solutions that he, as a government minister, felt he could implement. I'm pleased to see that this research has gone into that space, but I would like to invite all of you to engage more actively in helping us devise those practical solutions. In this area of NCDs and diet and nutrition, I think it is fair to say that there are some seductively appealing but perhaps oversimplistic solutions in the areas of taxation and controls on advertising. Advertising these days, we're the wrong generation. Advertising these days isn't about TV commercials and radio commercials. Advertising is those messages that pop up on Facebook unexpectedly. Advertising is the hidden messages in video games. So we need to be clever. If we need to be more subtle when we start talking about things like advertising bans. And I think it was interesting, I don't know whether any of you, I'm sure many of you, had the opportunity to be present at or look online at the debate, the speakers' debate last night on NCDs in Suva. I was actually watching it on my phone online as driving over here. I wasn't driving. I think we've got to be careful that we don't just fall into the simple trap of criticising and vilifying big multinational companies. It's not that straightforward, as I think the Minister herself made clear. There are many local suppliers, manufacturers, wholesalers, retailers, who are just as guilty about providing Fijians with inadequate healthy choices in the food they eat. I myself have, bought bread from a bread shop here. I swear it was made with seawater. It was so salty. It is very difficult often to make those wise, informed, smart choices. Another story, I was out walking in Suva and I was really thirsty, so I popped into a shop to just buy myself a bottle of cool water. The fridge was there. It was full of all the full sugar versions, which were nice and cool. Round the corner on the shelf in the 30-degree temperature were all the diet versions and the waters. What message was that retailer saying? How easy was that retailer making it? They could still make money by putting the water and the low sugar drinks in the fridge and the high sugar ones out in the heat. How do we change those sort of decisions on the part of our retail sector as well? As I say, it's not all the fault of the big boys. So, in conclusion, and having given you those messages, please help us with those practical solutions. So in conclusion, I'd like to express my sincere appreciation, and the Minister on her behalf, sincere appreciation to the Dean and staff of the College of Medicine, Nursing and Health Sciences, to the stakeholders in particular, to the Food Technical Task Force Advisory Group, all the other agencies and groups that have been involved, and my team at the Wellness Centre for joining with us. I think we're at the, if you like, we're at the end of the beginning of a long and complicated journey. So I invite you all to stay with us, stay the course, and follow on the journey that lies ahead. So I look forward to a very informative, very interesting morning, and thank you, Vinaka Vakaleva, again for being here this morning. Thank you.